So when we age, a lot of people would have bad circulation in the leg, lower leg especially, because that's furthest away from the heart. And the vein is functioning as bringing the fluid back from the extremity back to the venous system or the lymph system to bring the fluid back. But when we age, a lot of people, they would have edema in the lower legs. That's because of the vein insufficiency. But when this kind of condition becomes extreme, you would have inflammation because the fluid can now flow back sufficiently in the lymph and vein system. And then the inflammation causes severe pain, burning sensation, and eventually can cause ulcer. So people having diabetes, they tend to have this kind of condition more, but people without diabetes, they can also develop this kind of condition due to aging and insufficiency of the vein valves bringing the fluid back. The conventional treatment in Western medicine is to use ablation to close up the vein. They think in that way the fluid won't come out of the vein, but actually if you close up the vein, then the fluid still cannot go back through your vein or lymph system, and then you still have edema. Or they use some kind of stent treatment to thinking open up your vein. But I know personally there's a person's mom has this kind of condition. They did the stent treatment, and because of that, somehow she said it blew all the junk in the vein to the lower leg, and then her mom does not have enough circulation to bring all the junk in the lower leg back. So eventually she had to have amputation. It can happen to a lot of people, and actually this kind of condition can also affect people in their 40s if they are heavy smoker. For whatever reason, there's a condition related to smoking. Like a higher percentage of people would have that in their early 40s, but it also happens to a lot of people in their late ages. And my mom had that, and we did not go through any conventional treatment, but before I got to know about stem cell treatment, we tried many different things like acupuncture, herbal medicine. It's not enough to help her. So when I first started doing stem cells, this was one of the tests I did to see whether stem cell really can help. There's not enough prior clinical research to show that stem cell can help this kind of condition. However, based on what I know about what stem cells can do and what stem cells can help regenerate, it makes sense that if you have inflammation from the vein insufficiency and stem cell is very good at reducing inflammation, then it should be able to help reduce the inflammation in that area where you have this fluid build up. And also, if it's due to the valve of the vein not functioning correctly to bring the fluid back to the heart, then if the stem cell can somewhat help the regenerate the valve, then it should help the function better. Then she would not have that kind of severe pain and burning sensation associated with that. I basically did an experiment, and it helped her in the months for that particular area, which is in her right leg. And then after that, we did 2 more treatments to help enhance the effect. And then since then, she has not had any problem in that particular leg. So that was done back in 2021. And then she started having the other leg problem, the same kind of issue, earlier in 2024. And we did 2 more treatments, and now she's fine. So the stem cell treatment in this kind of situation is again demonstrating the superior property of stem cell in reducing inflammation. So any kind of inflammation you have in the body, if you use the stem cell treatment, I think it can help reduce the inflammation and help regenerate the tissue that is damaged by the inflammation.